The OECD, the organisation that brings together some of the world's richest nations, is predicting that the British economy could shrink by 11.5% this year or more if there's a second wave of coronavirus infections. It predicts Britain will experience one of the worst economic downturns of any developed country in the world. Well, our economics editor Faisal Islam is with me now. And why is Britain so vulnerable?
Sophie, at the beginning of this, the hope was that, yes, the economy was going to be hit by this pandemic, but there could be quite a rapid rebound in the shape of the letter V. This report says at the world stage that's not happening, and some countries are being hit more than others, including the UK. Let's take a look at what the OECD said in its forecasts for 2020. Most advanced countries hit. These are still pretty big numbers, even as they will appear small later. Germany, they're down nearly 7%, USA just over 7%. But you get down to the bottom of this league table for 2020 in terms of the forecast. Italy, France and the United Kingdom at over 11% hit in 2020 forecast. And the reason why the United Kingdom is considered to be most exposed is because of the structure of the economy, very global, also lots of services, lots of tourism, but also its exposure to the actual underlying health pandemic problem. Two things combined, and that's the sort of number that you get. There isn't a criticism of government policies, praise for the quick move on the jobs retention scheme, some concern about the compounding effect of the pandemic and a no trade deal Brexit. But some will compare that number with Germany's, the fact that deaths too don't compare well, and we will get real data on this for April, the first month of the lockdown, at the end of the week.
Faisal, thank you. The latest official figures from the government show that the deaths of 245 more people from coronavirus have been registered in the last 24 hours, taking the overall death toll from the disease in the UK to 41,128. Meanwhile, health experts in England are warning that the number of people on NHS waiting lists could double to 10 million by the end of January. The NHS Confederation, which represents all NHS trusts, is concerned about challenges ahead as hospitals try to restart treatments that have been put on hold. Our health correspondent Catherine Burns reports.
A birthday party in lockdown is never the best, but Jock needs an operation because he's deaf.
Cochlear implant.
What does that mean?
It means I hear better.
His family were hoping he'd have the surgery before he turned 5.
So his operation was cancelled pretty much the day before surgery, and it was just before lockdown. The news for us was really, really devastating. Every week, every month that goes by, he's getting older, and the outcomes will not be as good.
The NHS braced itself for coronavirus, partly by cancelling routine surgery. Now, a prediction that 4 million people on waiting lists in England could turn to 10 million by early next year, assuming there's no serious second wave. The NHS is a big, complicated machine, and it quickly changed gears to deal with the coronavirus pandemic. Now it's time to get things up and running again, but health bosses are warning it's not going to be as simple as flicking a switch and getting back to business as usual.
We need to have a grown-up conversation with the public about what the health service and indeed social care can do over the months and years ahead, because it will be restricted and we will be desperately trying to make good some of the damage that has been done over the months of the pandemic.
He says that conversation needs to explain that staff who've been working flat out during the pandemic now need to turn to the backlog. Hospitals will have to stick to social distancing too, which won't help get back to capacity. Irene's hip replacement surgery was supposed to happen today.
I'm really depressed today because I was supposed to have my operation and it hasn't happened. And I've got no idea of when they will do the operation. The pain is constant, it's there day and night. I'm on very, very strong painkillers at the moment.
I have regular assessments for a heart transplant, and unfortunately that's been cancelled indefinitely. And I can't help but be concerned by that, because without a heart transplant, I won't survive.
There's a call for more funding, but also to extend a deal where private hospitals have helped to support the NHS. The government, though, says the health service doesn't need that to carry on.
If you look around the world, it's seen as the best of the best in the world, and it will continue to do that as we come out of the COVID challenge.
Meanwhile, there's no word yet on when Jock or many others will get the surgery they need. Catherine Burns, BBC News.
Scientists are still not sure how many people get coronavirus from those who are infected but have no symptoms. The World Health Organization has admitted it's a big unknown. Some think it's rare for the virus to spread that way. Others fear those so-called asymptomatic cases are responsible for around 40% of all infections. Here's our science editor, David Shukman.
This is a message from the government's chief medical officer about coronavirus.
If you or anyone in your house...
For months, government advice has focused on symptoms, how you must isolate if you get them.
You should all stay at home.
But what about people who don't look as if they have the disease, but are still carrying the virus? Like paramedic Chelsea Mason, who had a test for coronavirus and expected to be clear.
I felt absolutely fine. Came into work and had the test done, and then a couple of days later, I got a call back saying it was positive, so really shocked because I had no symptoms whatsoever.
So how many cases are there without symptoms? A study at Addenbrooke's Hospital in Cambridge found that 3% of the staff were positive but didn't show it. In the US, at a care home in Washington state, the numbers were higher. 56% of people with the virus had no indication of being ill. And on the Diamond Princess, a cruise ship off Japan, as many as 72% of positive cases showed no symptoms at all. So why does it matter if people have the infection but don't have any symptoms? Well, for two reasons. First, if someone becomes infected, it may take 5 days before they show any signs of illness. But for the 48 hours before their symptoms start, they could be passing the virus on. Then there's the category of people who catch the virus and at no stage have any symptoms at all, maybe for 10 days or more, no one really knows. And scientists are desperate to find out how much they can spread the virus.
One of the first things I thought about really was, oh my God, I've done 2 night shifts. I've come into contact with, 6 or 7 patients per night. I've been with my crewmate for 12 hours. As much as we minimise the risk, that there is still that risk there. And with me being positive and not knowing about it, I could have passed it on.
Yeah, so just lower your window for me and I'll pass the test through to you.
Working out if that's going on now is really difficult. The government is mainly testing people who may have symptoms. Those who don't might slip through the net. So scientists in Norwich want to test the entire city. 100,000 people. They say it's the only way to discover who's spreading the virus.
If you don't realise you're ill, as we come out of lockdown and people are going to have more contacts than they did previously, the risk from those individuals is likely to increase.
The upshot is that keeping a safe distance still matters. And where you can't, governments around the world are recommending face coverings in case you've got the virus and don't know it. David Shukman, BBC News.